Prepare the skin surface by wiping with alcohol and drying thoroughly. Adjust the attachment plate's shape to the skin surface curvature by bending them as needed. Peel off the adhesive tape's cover underneath the plates. Align both plates on both sides of the lesion or wound. Attach the plates to the skin and adhere them firmly. Insert the strap to the lock-release mechanism of one plate and then of the remote plate lock-release mechanism. Press the lock mechanism to secure the strap. After the strap is fully inserted, tighten the approximation strap gradually to enable safe skin stretching. TopClosure 3S system, simple solutions for complex problems.